Let me see. So what do I want? Okay. How are you? Well, I'm now going to examine your abdomen. Do you have any pain in your abdomen? The patient says, "Oh, a little bit of discomfort." Then you start going. You are now going to start your PQRSTU questions. A little bit of discomfort. So where is your discomfort? Oh, right here, in my right here. Okay, the patient is pointing to here. You do not expect the patient to say in my appendix area. Okay, so it's my lower. You think you are going to commit that to memory, so right lower quadrant. Okay, so how long have you had this pain? I specifically asked for standardized patients, so your documentation will depend on the answers to your questions. So the patient will say, "Oh, just about now." You will think like, "Wow, just about now." Okay. So what else? What is the next question? How long?
How long?
Can you describe your pain for me, please?
Reason,
Oh, it's just
severity.
a little discomfort. You know, it's not that it's not that pain. It's like a dull ache, but not a lot. So from 0 to 10, on a scale level, what is your pain level now? So about 2. Okay. What do you think will make it worse? I don't know. I really, at this point in time, I don't know yet. Okay, what will make it? Ali, have you had this before? Or once in a while, I get this pain on my right lower quadrant. And there anything,
That
other symptoms
brings it. Oh.
that are associated with? No, not necessarily. Oh, now I remember. I think I eat a lot of milk or dairy products or beans or whatever. But what is this? Why is it on the right if that is going to be gas? So did we answer the PQRSTU already? Oh, how does it affect you? For now, it's okay. I'm okay. It's not affecting me in any way. So the answers to those will be the content of your pain assessment. Then, all right. So now I will proceed now to the examination of your abdomen. And is the patient on proper position?
Yes, I know.
All right. And
Does he
then
have
we
a
can
pillow?
I think
sing.
that's like okay. Yeah.
Are we gonna have to place a
Just
pillow?
Can
You want
you
to butt up?
lift your legs or flex your knee or place a pillow? Now I am going to expose your abdomen, okay?
So this in station 4 is gonna be a live patient.
Yeah.
Yeah, I requested for that. But in case there is no live patient for whatever reason,
Yeah. Yeah.
okay.
Under like it's under the knees.
Under the
correct?
knees.
Yes. If the patient can flex by themselves or herself, that's fine. Okay. If not, you put a pillow under the knees. And
So most
okay,
probably
we're
the patient's
to-
gonna be able to flex by themselves.
okay. So now the
Yeah,
the
most-
abdomen
So you don't need a
exposed,
pillow.
you can already see the abdomen. You do see a peristaltic movement that is visible. Do you see any palpation? Although it's not here, but since you already exposed the patient, you can already inspect, right? So now we are going to say, I'm going to listen to your sounds of your abdomen because I'm inspecting now. I'm going to auscultate. So since the patient is complaining of discomfort but not pain, can I start on the lower quadrant? So I will tell, since you are having some discomfort in this area, I'm going to do that last. So I'm going to start from here. So I place here,
So you start from the upper quadrant.
yeah, right upper quadrant. Just be systematic, okay? Because there are patients that you cannot really start from. Right upper
Upper
quadrant,
quadrant.
Left upper.
Left upper.
left upper quadrant, left lower quadrant. Okay, so there. What else? Now I am going to listen one more time to your aortic. Should I hear something?
No.
Probably you will be hearing some pulsation.
With
But
the
that you-
bell, right?
Yeah, with the bell.
of the
Bell, yeah.
stethoscope. Okay, and then I'm going now
Diaphragm just for long.
to listen to the renal arteries. So you see from the epigastric area, either I can move my stethoscope to the left
Mm-hmm.
and I go to the right to compare the
Bilaterally. Mm-hmm.
kidney, renal arteries, and then from here I can move it down here for my
The
iliac
last. Okay.
arteries, and I go to my left side for the iliac, and then I can move down
To
to
the-
my. If it is a real patient, you do not go.
Wanna
in there.
go
You just
there, yeah.
you just say that I am going to listen to the
Inguinal.
inguinal or femoral.
Femoral.
Inguinal. What else?
During this
Then-
whole time of auscultation, bell or diaphragm?
No.
It dep-
Diaphragm.
A diaphragm for the vowel
For the vowel
sounds.
sound.
Bell for
for-
the vascular sounds.
Oh, okay.
So in your charting, because these patients are, even if it is a normal, if it's standardized patient, would you hear some brewing probably? Not.
I hope not.
Vowel sounds? Yes. Okay. Next is you are going now to, now I'm going to now tap on your abdomen. Okay.
Okay.
So I am going to start from my right upper,
Upper quadrant.
because I'm
Want to save that one, yeah.
last in terms of, especially when I do my
Palpation.
palpation. So technique is you are going to you are dividing the imaginary line from the xiphoid process crossing to your umbilicus. So they're actually the right upper quadrant is right here. But since this is the only place for the right upper quadrant, so you are going to and then let me see here. Oh, that is painful. A little bit more uncomfortable. Now we are going to do the general percussion. Okay? I'm going to push your abdomen. Okay, push a little bit so you can feel the surface.
With the palpation.
Palpation.
So the light palpation and then the deep palpation.
Light palpation. You are feeling for the. Now, we would like to see your fingers moving like this,
Okay.
and like that. So you are sliding, you are sliding, you are sliding, you are sliding. Or if you have told me that, we can do that later on. So I have my own video, like that,
You look beautiful.
like that, like that, like that, and then let me touch this one. Is this painful? No, if you touch it that way, it's not that painful. Okay. Now we are going to do your deep palpation. So if you can use your one hand to really palpate, or you can use two
Indirectly,
hands.
okay.
Okay. Now this is like this, and you go over here. You go over here. Now what, for me, I like to do this way. You slide, you slide, you slide, you slide, and you go back here. You slide so that you are feeling everything in the abdomen. And you go back. So you dip. Now this is your hypogastric area, which is when your bladder is distended. You can feel that, and the patient is going to say. Now I'm going to touch here, okay?
Oh.
Oh, that hurts a bit more than the usual. Okay. How about here? Yes, about here. Yes. All right. Next is, so you are free to go look like that. All right. Let us now go for your, I forgot the percussion for the lower border or the liver span. So, all right. Let me go. So, if you miss that, then if you catch it, then you can go back, although it's not supposed to be. So you are going to start where? At the level of the umbilicus, right mid-clavicular, and you are going to tap. When we did this, we used our percussion hammer. So you are going to tap, so timpani, timpani, dal. I'm going to write something, or
And will they give us a
pick,
little marker?
or your
Well, it'll be
tape.
marked up, the patient will be.
Oh, do not write. If you are using this, do not.
No, but on a real person.
On
though?
a real person, use tape.
Oh, use
tape.
tape. Okay. So we'll have tape here, or do we go get tape before we
No, we
begin
just
the
say our
assessment?
mark here.
Or all marking?
You have to have your thing in your pocket already. So if you think you are not going to tape, a small tape.
Okay.
What's a big deal of using a small tape? Piece
No.
of tape.
We have there, right? Okay.
Or you can have it. And then from here, you are going to percas, restaurants, and then you dal. So you are going to say from here is from there to here. I measure that as the liver span, and you can even say what is the normal liver span.
It always says lower liver border. We have to do the upper border also?
Here, I corrected that liver span or border.
So.
So we're doing upper and lower.
Doing the whole liver.
Wait, like we're
Wanna see
assessing
the
the
size
liver
of the liver.
size.
That's
Oh,
the
you
size,
understand.
yes.
Okay.
Do we palpate
Alright.
for the liver?
Upward, right?
Like do we do the
Then we
hooking technique?
palpate for the liver. Okay,
Okay.
there are two
Two
approaches.
methods. Yeah.
So you can either slide your hand under, push it up like that, and you push your fingers over here. Okay.
And that one's on
Or-
expiration that you feel it, or inspiration?
Or you can ask the patient to inhale, okay, inhale, and as the patient exhale, you
They'll
may
fall. Okay.
you may feel the edge of the liver. So inhale and then exhale and you
Okay.
palpate. What else? Then you are going to palpate for the spleen. You don't have to move your side. Can you just hold this? Go over here and you reach over towards this and you point your finger lower rib cage here and you point your fingers and I push this one and inhale, exhale. Should we be
No.
and you can already from your spleen you can slide your hand to here for your kidney and then you
And you shouldn't
palpate.
feel either, right?
And then when you move your hand to over here, you are going to position this and you are going to palpate here. Now,
We're running short on time. Can we just do one?
yeah, and you can just say the right kidney and then the position for the right kidney is like this. Okay. But for the liver and the spleen, yes,
Yeah, yeah.
both. For the right kidney, if you're looking like 2 minutes or few seconds already, then you can just, oh, this is how to do the right kidney and this is how to do your left kidney. Okay, what else? Am I done? Aorta. All right. So, sorry, Mr. Gonzalez, I need to do your aorta. So your thumb and forefinger, or even your middle finger, you are going to capture that here in the xiphoid processes lower, and then you feel like this. Okay, like that, the aorta. Okay. All right. So we're done. Think 5 minutes is over.